Welcome, welcome, welcome. It is that time we do every week here, and that is Ask Dr. Geier Live. Wherever you're watching, I hope you're making today your masterpiece. My name is Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of your age, any injuries you've had, or your medical history. In case you're wondering, no, I am not wearing scrubs today. It is a cold, dreary day, and I've been working and doing, not working like seeing patients, but other kinds of work, and I've been studying. I think I've mentioned on here before, I am trying to get a third board certification in anti-aging and regenerative medicine, and there's a written exam for that. So I've been studying a lot today, and I felt like wearing my Memphis Grizzlies sweatshirt. They play tonight. I'm a huge Memphis Grizzlies fan, so that's why I am doing that. As I say every single time we do Ask Dr. Geier Live, and I really say this in just about every video and certainly every live stream, nothing I say here is meant for medical advice. This is meant for general information and educational purposes only. I haven't seen you, I haven't examined you, I haven't looked at x-rays or MRIs or any of that. So everything I talk about is sort of meant in a general sense about whatever that injury is, whatever that surgery is, recovery, all of that kind of thing. Plus, if you would like to see me formally as a patient, one of the few orthopedic surgeons and sports medicine specialists that also focuses on innovative treatments to try to keep you from needing surgery, needing cortisone shots, physical therapy, things like that, and you want to know about other kinds of treatments that might be possible for you, I'd love to see you. The description or the link to my website is in the description below. Go to the contact page and you can request an appointment. Now, the reason I do this once a week, just so you know, while we're kind of letting everybody kind of get in here, is I do this once a week because this is the only time each week that I answer questions. And I know I get people that are frustrated because I get 30 to 50 comments on all my YouTube videos, and they all are asking questions for medical advice, really having nothing to do with the video or only to do with it in whatever the topic was. But I get 30 to 50 of those a day. When I had comments on my website, I was getting hundreds of comments a day, and it's all just requests for medical advice. But I've got a real job. I've got to see patients and everything that comes with that. I've got, I'm doing videos, 7, 8, 9 videos a week on this channel. I am the media medical expert for 2 TV stations here in Charleston. I'm on TV every day, and I've got a life. So this is the only place I answer questions other than in my practice, and this is the only time, and that's 12 p.m. Eastern time. And yes, you have to be there live. Also, if you are watching, please leave your questions in the chat. Do not leave them in the comments. I'm not actually on YouTube. I'm using a service called Restream because it allows me to do things like change what's on the screen and put music and all sorts of things. And so I am not on YouTube, so I cannot see the comments and will not answer comments there. I only do them if you post them in the chat, for what that's worth. And I'll have a couple other things to say, but Jamie, I very much appreciate it. Always here. What can you give me shots besides cortisone shots? So there's a lot of options. It really depends on the problem people have. Cortisone shots versus other types of injections, supplements, medications, things like that. So cortisone shots, we'll just use the most common indication, and that is giving it to people for arthritis, typically knee arthritis, but it can be just ways to sort of decrease pain in the knee or the shoulder. Unrelated to arthritis, we see that with rotator cuff impingement in the shoulder. People do cortisone shots and use it for tendon issues like tennis elbow. The problem with cortisone, let me back up and say, she is already one step ahead of us saying what can we do that's better than cortisone, because she's right. Cortisone tends to help a little bit in terms of pain short term, but then it tends to wear off. And the problem is a lot of times people are actually worse off after a cortisone shot than they were before. We know in arthritis, in knee arthritis, that it speeds the breakdown of the articular cartilage. You might get away with one, but certainly multiple injections very likely are going to speed up the acceleration of your arthritis. That's certainly not a good thing. I really am not a big fan of that for younger people. Not a huge fan of cortisone generally for arthritis, but I guess once you're bone on bone and you're old, maybe it's not as big of a deal. For tendons around the shoulder, for instance, or around the elbow, so rotator cuff impingement, shoulder impingement, what we used to call tendonitis or bursitis, if you've ever heard people talk about that, we know that rotator cuff, or that the tendons of the rotator cuff are weakened by the steroid in cortisone. So a cortisone shot, yes, you may feel better, but you may have weaker rotator cuff tendons. With tennis elbow, makes that the extensor tendon off the edge of the lateral side of your elbow more likely to rupture and less likely to heal. So despite the fact that you feel better later, you're much more likely to have a recurrence of your pain. You can't inject steroids into tendons anyway for increased risk of rupture. Achilles tendon, patella tendon, that's been seen. So I suppose there's some indications for cortisone, and maybe just a one-time injection for an acute flare-up, maybe it's worth it. I try to stay away from them if I can. In terms of knee injections, there's a whole host of things specifically. We're just going to talk injections because otherwise this could go on forever. But for arthritis, there's hyaluronic acid injections. Studies are okay for that, not great, but may help in sort of a lubricant effect. There's platelet-rich plasma that I've talked about on my Better Than Ever live show, and there's a playlist on my channel called Modern Medicine that talks about PRP for not just arthritis but a variety of other problems. There's stem cells, there's exosomes, there's a peptide called AOD 9604 that can be injected into the knee a series of times along with hyaluronic acid to try to actually fill in the cartilage damage. All of that can be potentially good. If it's a tendon injury instead of cortisone, yes, platelet-rich plasma might be helpful. And then there's all kinds of non-injectable treatments, and it really depends on the problem. So that's about as much as I want to say about it without getting a little more specific as to what the problem is. But hopefully that helps. So Jamie says only 29. Yeah, definitely I would try to avoid cortisone at 29 years old. I know that every orthopedic surgeon in the world seems to give it to everybody. The studies are very clear that is one of those short-term benefit, much greater long-term harms. It's really not my big thing. Yes, it may help with your range of motion. Yes, it may help with your pain. But again, in the case of the shoulder, weaker tendon, it's just, I don't know. I would argue physical therapy. I would argue maybe PRP injections depending on the problem. It really depends on the nature of the problem, but I doubt cortisone. Cortisone is not, here's the other issue. Cortisone is not fixing the underlying problem, whatever it is. It's not making the arthritis go away. It's not making the rotator cuff impingement problem better with weaker tendons and poor mechanics of the shoulder. It's not fixing the degenerative part of the extensor tendon on the outside of the elbow. Whatever it is just relieving pain short term. So for what that's worth. So that is all I've got. If nobody else is going to answer questions, this is going to be a very, very short episode, which is good because I want to get back to studying. I hope you have a fantastic rest of your weekend. Those of you in most of the United States are going to be dealing, I think this is daylight savings weekend when we spring forward. So that should be lots of fun. I'm excited to be here. I'll be here next Friday. I don't expect I'll be missing any Fridays for a while at least. So I'm excited for you to join us. If you know people that have orthopedic injuries and questions, definitely send them my way. 12 p.m. Eastern time on Fridays, only on YouTube, not on Facebook, not on LinkedIn Live, where I do my Better Than Ever live shows as well. This one is just on YouTube. Also, again, if you want to see me formally as a patient, because I'm a double board certified orthopedic surgeon and sports medicine specialist and focus on anti-aging and regenerative medicine, the link is below in my comments. Jamie, you're welcome. Pars, ask real quick or I'm going to be going. But definitely if you want to see me, you would have to come to the Charleston office. I do not do telehealth visits because I don't have a medical license in states other than North and South Carolina, and I don't really want to spend the time or money trying to get them and keep them active every year. It's just not a good use of my time, and at least for now, that's the plan. So people come to Charleston to see me. And I got patients from all over, but yes, unfortunately, you got to come to Charleston. But we can talk about all kinds of treatments. All righty. Yeah, no worries. Yeah, I don't know what that means, but yeah, Pars, I'm here every Friday, 12 p.m. Eastern time, depending on where you are. I know a lot of people that come to this chat are from overseas in the Middle East and India and all that, and they're coming at long periods of times. I do PRP in Charlotte, actually. If you want to reach out to my contact page, I do it both in Charlotte and in Charleston. The trick is at our Charlotte office. Of course you'd have to come because it's an injection. I was going to say, I don't take care of patients at our Charlotte office that aren't from North and South Carolina in case we have to ship medications or anything. But for an injection, you'd have to come anyway. I can't actually do that from a distance. But yeah, definitely go to my website. I don't have something to put on the screen, but it's in the description below, drdavidgeier.com. In the upper right corner, there you'll see something that says work with me, a drop-down box that goes to contact. Click request an appointment, put a little note, and it gets to my assistant who can potentially help you out. Anyway, I really, really, really appreciate you joining. I hope everybody is healthy. I'm assuming that they are, given the lack of many questions today. I will see you right back here on Friday. But if you're interested in NAD and its role in aging and why NAD drops with age and how you might boost it, we'll be talking about that next week on Better Than Ever Live, Tuesdays and Thursdays at 12 p.m. Eastern Time as well. And we're also going to be talking about a peptide that is really popular. That's thymosin beta-4, or TB4. Some people call it TB500, and its role in recovery from injury. So if you're interested in TB4, you're interested in the role of NAD and aging and how to boost NAD, join us Tuesday and Thursday, 12 p.m. Eastern Time. Same place, drdavidgeier.com. YouTube.com/Dr. David Geier. Subscribe, click the bell to be notified. I am also going to be starting sort of spontaneous live streams occasionally, just on various topics, that then I turn those live streams into recorded videos that will go on the website about a particular topic. So you may see me just pop up spontaneously, and if you do and have a question about that topic, definitely join me. All right, I will see you right back here next week, 12 p.m. Eastern Time, Tuesday, Thursday, Friday. Have a wonderful weekend.